Okay, great. Well, Stephen, thank you for joining me for this interview. My name is Shreya, Jani. We actually know each other pretty well by now. I'm the head of corporate affairs at BeiGene, and I'm just really excited to be talking to you about Blood Cancer Awareness Month. As you know, September is Blood Cancer Awareness Month, and I've looked at the CLL Society's website. You guys have been doing quite a bit on this. So it's a good time for us to maybe catch up and talk about what you're doing at the CLL Society. I know you're a volunteer there. I'd love to know a little bit more about how you guys are raising awareness of Blood Cancer Awareness Month.
Well, first of all, my pleasure to be here. As far as the CLL Society, they're part of promoting the Blood Awareness Month, Blood Cancer Awareness Month. I'm not even sure if I have the wording down correctly. It's something that was the CLL Society puts out a weekly alert, which is soon to be renamed. That's an email that goes out to everybody who is signed up to get it's basically like a weekly newsletter. So they're making our members aware of it that way. And also what our Facebook presence is making that announcement as well.
But tell me a bit about, if you don't mind sharing, your diagnosis and when you were diagnosed, and sort of your pathway to becoming a volunteer, if you don't mind sharing your story.
Sure. Well, I was diagnosed in 2014 at the age of 54 at my annual physical. I usually would show up for my physical just to sort of see what my cholesterol was in particular, and then gloat because I usually have very low cholesterol. So I really had no other ambition than that. And my white blood cell count was just a bit elevated. I don't remember the exact number, but it may have been around 12,000 or so. And I think the upper normal limit is around 11,000, give or take. And I had the test repeated about a week later, and with the same result. And that, I didn't have an infection at the time, so there was no obvious health issue or crisis going on. And ultimately, I prevailed on, or a friend of mine who's a doctor in New York City, suggested that I see a hematologist, and I connected with that doctor, and they did the same, CBC, general blood work, but also did a flow cytometry and a FISH study. And it was at that time that I got the call that we have something to discuss. And I learned that I had chronic lymphocytic leukemia. I should say that it confirmed that I had chronic lymphocytic leukemia because contrary to the advice that most people get not to go online and start researching their symptoms, I think my platelet count had dropped a little bit. So I recall doing a search on elevated white blood cell counts and lowering platelet counts. And Dr. Google told me that I had chronic lymphocytic leukemia. I'd never heard of it before. And like most people who get the diagnosis, all they hear is leukemia. Right. They don't know from the various types and the maybe innumerable subtypes of leukemia. So you just go into, I don't know that I went into freak out mode, but I just, that certainly got my attention. That, it was right out of left field.
In your research and in your action, did you feel like you were properly diagnosed? You had the right amount of information?
At the start, like most people, I was just, consuming what I could find, just doing a general search for chronic lymphocytic leukemia. Okay. And I was, for what it's worth, not a lot, a chiropractic student at the time that I became paralyzed, spinal cord injury. That's the next hour's phone call. But anyway, so I had a little bit of I had enough vocabulary, to do, some kind of meaningful search. But when you're looking at old data, if you're looking at data, if you're diagnosed today, for example, in 2021, and you don't know anything about CLL, and you're looking at publications that came out in 2007, and looking at mortality charts, and you come across a figure that says you have 5 years to live, you're going to basically be torturing yourself for nothing, because that data is essentially meaningless, especially in the CLL world, where there's been a major paradigm shift from all of the treatments that have come online since 2014, in particular when a certain BTK inhibitor was approved by the FDA. So I was probably torturing myself a little bit with bad data. I ultimately discovered Brian Kaufman. He's the director of the CLL Society, the founder of the CLL Society, along with his wife. And at that time, there was no CLL Society, but Brian was blogging about his own journey, and I chanced upon his blog and emailed him. I was still living in New York. Brian lives in California. And Brian answered a lot of my questions very graciously. He's an incredible person. And then ultimately, when I moved to New York, which was not long after my diagnosis, just months later, I connected with him. And then at some point, I don't remember the timeline precisely, but the CLL Society was just minting itself. And they had their first patient education forum at the City of Hope Medical Center, which is a premier cancer facility in Southern California. And I met Brian at that time. And they had at that time a support group in Orange County, which maybe dated back 7 years or 8 years at that time. And they were looking to start a second support group, and they were looking for somebody who might be willing to facilitate it. And I signed up for that. So I knew still, had my knowledge about CLL was quite minimal, but I got myself plugged in and networked, and that had a major, it had a profound effect on how I ultimately got treated.
Yeah. Well, I guess your clear point that I heard is there are treatments available in the last decade, and they definitely changed the outlook and the experience of people newly diagnosed. So,
absolutely. Yeah, I like to a line that I coined for people who are newly diagnosed, and then they're going all over the place looking for information and they're freaking out. I always tell them that their anxiety didn't go to medical school. And it does take a while, especially with any new diagnosis. You're being introduced to a tsunami of acronyms and concepts and all sorts of things that people don't know anything about. They can't pronounce the name of their disease, let alone all the drugs that are unpronounceable even by many of the professionals. So it does take a while to build up your knowledge base. You need multiple exposures to basic information. And that's something that the CLL Society and our support groups in particular, I think, are very effective at delivering. So a little bit more background regarding my treatment. I was treated in 2017 with a BTKI inhibitor and a monoclonal anti-CD20 monoclonal antibody. I got to a complete remission and measurable residual disease undetectable at the flow cytometry level. I also had a next generation sequence thing, but that we can discuss that later if that's of interest. But my Ig levels, like most people with CLL, even if you get to a complete remission, your Ig levels, your immune system is still compromised.
So what's something from your vantage point, people working on new blood cancer treatments, people working in this area like BeiGene is, what is something that you'd want us to know, or something that you'd want us to focus on as someone from the CLL Society?
And the pipeline doesn't seem to be even close to being exhausted yet. So more treatments, and I can't keep up with all of the new names because I'm not in a position where I have to consider treatment for myself. So I'm falling a little bit behind. But I know at the time that I was, and this may be a good segue into discussion about clinical trials. When the decision was made that I needed to start treatment, my doctor, who's the provost at City of Hope, wanted me to enter into a clinical trial that they were running. And I think it was being offered at many locations. My clinical trial. And as a result of that, I didn't know what that build might look like. And that was a source of considerable stress and anxiety. I did not enter that clinical trial. Instead, I got a BTK inhibitor that my insurance company approved. And to my surprise, they also approved this, latest generation anti-CD20 monoclonal antibody. I guess they're on different formularies. One's a drug formulary, and infusion drugs fall into a different category.
You're raising the real barriers to entry in clinical trials that are probably not fully understood by many of us.
But I kind of had the impression that clinical trials are free. It's all free, not just that the drugs are free, but everything related and associated with it is also free. And that's not the case. With the Affordable Care Act, I think clinical trials became an option for people that didn't exist before, but each state has has some sort of jurisdiction over what aspects of the clinical trial are covered. So, so you got to do your homework, and the financial strain, that's a real thing. So
if you are looking ahead now, next decade, what are your hopes for the community? What are the few things that you hope to see improve in the next decade? Clearly, barring having a full-blown, having a cure would be the best, obviously.
So I think with the tremendous stride that's being made in all the various treatments, more and more people are looking like they're cured, even if you can't quite call it that yet. So I think that people who are newly diagnosed can, for the most part, almost everyone is responding to the new drugs, even if they had what were the worst prognostic markers historically, like a 17p deletion or a TP53 deletion, or some of the more obscure mutations like a Notch or SBF53. So I think people should take comfort in knowing that there are an increasingly large arsenal of drugs that are available to them, and if they have good access to them, for me it was a very tolerable course. I had a very unremarkable journey once I started treatment.
Well, Stephen, thank you for sharing. We really appreciate it, and we think it's important for people, to newly diagnosed or not, to hear everyone's stories, to know every journey may be different, but there's so much we can learn from each other, and we're not done yet. So we'll continue to work together and plug ahead on the science side, but also raise awareness about this so that people know the considerations and that they're not alone in dealing with their diagnosis. And thank you for everything you do as a volunteer.
My pleasure.
Okay, thank you.